Hi, Dr. Roadhouse with Regeneration Nation Stem Cell Therapy. I want to make a video for people that have had stem cell injections in the knee. And one of the main things is, you can go and do your regular activity, but we don't want you loading the knee, which means we don't want you to lift anything heavy. Not a good time to move furniture, going up and down ladder, carrying anything heavy, because we're laying down a new layer of cartilage on the joint, and if you're compressing it like that, you're going to damage some of it. The other thing is we don't want any impact, where you're running or anything like that, because we don't want you to damage the cartilage. So as you start to improve, we want to do some stretching and some strengthening exercises, because you have started walking a lot differently. You might be putting more weight on one leg. You might not be moving the knee the normal heel strike and going up the toe and bending, just because there's a lot of pain and you don't have a lot of cartilage in that area, and the swelling might be prohibiting that. So as you start feeling better, you're going to start noticing that you're feeling better, the pain's going away, the swelling's going away, and the knee's starting to move a lot better. So what we want to do is we want to start with some stretching. You don't have to do anything major, but just want to try to stretch, the muscles on the back of the leg, because they have tightened up to try to protect it. So you're just going to go like this. I'm going to move this chair there. And you're going to go on your heel like this and just stretch like this, just leaning forward like that, keeping your legs straight. Now if you can't get it all the way straight yet, then just go like that, and you should feel it stretching back in that area there. You don't want to bounce like that, because that's going to cause some problems. There's microscopic tearing that can occur, and we don't want that. So we just want to go as far as you can until it's tight, and then just lean like that. You might need to hold on to a chair or counter so you don't fall, and then just stretch like this and hold it for about 45 seconds, and then just do that several times during the day. The other stretch that you can do is you want to go like this and stretch like that. You're going to feel that loosening all the muscles in this area here. You might not be able to do that at first, so if you do, hook a string on there, a rope, or some people use a belt, and just hold it like that and pull it up until, like, if you can't do it like that, just pull a little bit more and then hold it there for 45 seconds. And what you'll notice is over the weeks that all of a sudden you're getting more range of motion. Another good stretch to do is this right here. And you just want to lean forward like this, and you're going to feel probably a lot of pressure in this area. Go to where you feel the pressure, and then just hold it for 30 to 40 seconds. Then just try to do it several times during the day. The strengthening, we don't want you doing a lot of movement yet, because these muscles have been weak, and a lot of you had this problem for 10, 15, 20 years, and the muscles have atrophied. So we want to try and protect them, strengthen them, so they can protect the knee joint. So what we want to do is we want to start with some isometric exercise. So you just want to go like this, and just put your finger right here and squeeze. Your finger should move, if you can see that, like that. And when it does, you want to hold it for a count of 4. The other thing that you can do is you can sit down on the chair and then have someone hold your leg for you like that. Just go like this, and then just put 2 fingers there and push down, and you tighten it up like that. And then hold it for a count of 4, and do about 12 of each one of those. The other thing that you can do is you can go up against the wall, move your feet out slightly, and then what you want to do is just do a partial squat. And you can go right here, and then just come, when you get to the top, then squeeze the muscles. When you get down here, squeeze the glutes and the hamstring, like that, for about 4 seconds. Get up like that, 4 seconds. The next thing that you can do is go down as far as you can go, and if that's it, just sit here like this. It's called a wall sit. And you'll feel it doesn't feel like that big of a deal, but when they start quivering and hurting and stuff like that, time it and try to get where you can do it for a couple of minutes. And then as that gets strengthens up, then the next time you'll notice, oh look, I can go down here. Then you do the wall sit there, and that's when you do your exercise like that. So the exercise is going down, coming up, squeezing, going down and squeezing. And after you do 12 of those reps, if you can, or whatever you can do, then what you want to do is you want to go down and do a wall sit and just sit there and time it. Maybe you can only do it for 15 seconds. Try to get up to where you can do it for 2 or 3 minutes. We want you to do all that before you do any kind of weight-bearing exercises, or with body weight, or with weights, or leg press, or anything like that. Usually that's going to be past the 12-week time frame. So anyway, we've done over 300 pairs of knees, 75% of them have been bone on bone and getting great results, but we have to strengthen the joint around it because it hasn't been able to protect the joint for many years. So anyway, if you have any questions, call us at the office and we'll be happy to get back to you. Thank you.